Welcome to Redefining Medicine, an intimate and personalized program that illustrates a different side of the practice of medicine. Our in-depth conversations will focus on mentors and motivators who are consistently reshaping, redefining, and rediscovering the field of medical healthcare. I would like to welcome Dr. Ronald Klatz, founder and president of the American Academy of Anti-Aging Medicine and leading authority in the field of anti-aging.
Thank you so much for joining us today, Dr. Klatz. It is such a privilege to have this opportunity to sit with you and get to know about your background and the history of A4M and your partnership with Dr. Goldman and where this all began 25 plus years ago.
Well, actually 35 years ago.
Really?
Yes. My partnership with Dr. Goldman began in Chicago at the Chicago College of Osteopathic Medicine in 1981. I was an assistant professor at the time. I came on to the Department of Family Medicine, and I took a faculty position at the school. And Dr. Goldman was a fellow in my department, and he was my research assistant, my research fellow. And we began our collaboration at that time, and we did originally cutting-edge work in elite sports performance medicine. And Bob is, after all, a international athlete, and the department that I was in at the time had a strong interest in sports medicine. And so we did some interesting work in physiology of different sports performance activities, and the research went very, very well, and it seemed like a good collaboration. We went on from that point forward, and Bob and I were intimately involved in the progression of sports medicine as a clinical medical specialty, and from there we founded the National Academy of Sports Medicine, which by most reports is the Harvard of certified personal training certification and certified personal training education. So we were very successful with National Academy of Sports Medicine, and that was involved basically in elite sports performance training and rehabilitation. And from that, it morphed into anti-aging.
A phrase of which I hear you've coined.
Well, yeah, I have that going for me. I coined the term anti-aging medicine.
Okay. So how did it morph into that?
Well, we were involved basically in trying to create a medical specialty that would address the issues of athletes, primarily athletes that are injured. Sports medicine there, you were dealing with people who have a sports-related injury, and often these were senior individuals, or not, well, at least adult individuals rather than younger people. And it went from adults to seniors, and we were involved very much in physical medicine rehabilitation. And it became very clear to me at the time that if we could rehabilitate a senior athlete to perform as well as an adult athlete, sometimes as well as a young athlete, then there was a tremendous reserve capacity that was that had not yet been appreciated. And much of what we did in sports medicine had to do around nutrition, lifestyle, rehabilitation, had to do in some cases with hormone replacement therapy.
Back then.
Even back then, yes. Okay. And Bob is, after all, the author of Death in the Locker Room, which was the book, the seminal book that created the entire awareness of steroid abuse in sports and Olympic athletics. And so we had it was kind of I hate the term perfect storm, it doesn't sound right, but many things came together.
The stars aligned.
That's a good way of putting it, yes. Well, there was an alignment. And so with the expertise that Dr. Goldman had, and my background in physical medicine rehabilitation, and the new clinical science of sports medicine, this progressed and grew, and got to a point where there were so many new things happening at the time in the understanding of aging. You see, back in the 1980s, we didn't know what caused human aging. It was a mystery. It really was. It was a dark continent. Medicine did not understand human aging, and it was only through cell biology from the 1960s that we began to have the tools to understand how and why the human cells aged. And this information was leaking out of the laboratories in the 70s and the 80s, such that we had tools now that we could interrupt the degenerative processes of aging. Now, when we took those tools and applied them in athletics and with senior athletes, it became kind of clear that, wow, people should have more years than what we were used to. Now, it's hard for people to remember, but back in the 1980s, you were old in your 60s. People were old, and when they died in their 60s, it was, well, he led a full and complete life. Today, someone dies in their 60s, it's, oh my gosh, it's such a shame. That's so sad. He died so young. Because people are not old in their 60s anymore. They're not old until they're their 80s today. Some people maybe till their 90s. Okay, so there's been a quantum shift. There's been a tectonic shift of the planet with regard to what aging is. And I like to think that that's due in part to some of the work that we did in helping to create not just the National Academy of Sports Medicine, but also the American Academy of Anti-Aging Medicine. It certainly wasn't just us, but it was this entire new science, the biology of human aging that came together, and the clinical science of anti-aging medicine, and creating a society of anti-aging physicians, the American Academy of Anti-Aging Medicine, that for the first time made it possible, made it okay to even address the issues of aging, because back in the 80s, if you even suggested that there were technologies or methods or therapeutics that could forestall the aging process, well, you were a quack. Flat out, you were a quack, and there were doctors who were censured by their state licensing boards, and there were people who lost their licenses. There were doctors in the early 80s who were rated by the government agencies for giving vitamin C, for vitamin E, for nutritional recommendations. I remember when I was in clinical practice early on, when a patient came in with a cold, I would routinely prescribe high-dose vitamin C for them. And the agency, which was auditing our group, our hospital, came back and called me before a disciplinary board to question me. Why am I giving vitamin C to these people? Don't you know that vitamin C is dangerous? That
how did you respond?
That the FDA only approves 60 milligrams of vitamin C, and to give a gram or two could be like the outright malpractice. And I how can you respond? You go to the medical literature, you go to the scientific literature, and there were thousands and thousands of papers that supported the notion that high-dose vitamin C might be effective for improving immunity and helping to limit some of the untoward effects of the cold or flu or other infections. And they said, oh, okay, that's interesting. Next. And even though it was okay, they didn't accept it, but at least they didn't put the hammer down on me. But there were others who were. So I think the most important thing that the American Academy of Anti-Aging Medicine did was made it okay for doctors and scientists to say, hey, wait a second. There is more to aging than 65 years and retirement and, the grave.
So how did you initially conceive the idea of forming A4M? Like, at what point did you say, okay, we need to do something?
Well, it was after the success of the National Academy of Sports Medicine. And we had gone very far, because before the NASM, National Academy of Sports Medicine, there was no such thing as a CPT, a certified personal trainer. Personal fitness trainers did not exist, and now there are hundreds of thousands of them. We created an entirely new specialty. You can go into any quality health club now not just in America, but around the world, and find a certified personal trainer who's going to help you designing your program with your nutrition, with your lifestyle, getting back into shape and improving your fitness level.
And you can go into any country and find somebody who's gone through the fellowship at A4M for that matter.
That's true too. But back in the 80s, there was none of this.
Right.
So with the success of the National Academy of Sports Medicine and realizing how effective these therapies were, we thought we had to go to the next level, which was beyond sports trainers and bring this technology to physicians and to create a new medical specialty of anti-aging medicine. I was always interested in preventive medicine. I was always interested in the next breakthrough in healthcare. I was very technologically oriented from early in my medical career. I started out in medicine as a respiratory therapist, and that was the high-tech job in healthcare at the time. We used to take care of the people in intensive care units in the hospital and on ventilators and life support and that sort of thing. So I was very keenly interested in where the next technology was coming from and how to apply that technology to for healthcare. And I was drawn towards a group of scientists in Washington, the American Aging Association, mostly PhD researchers, looking at aging as a condition that was something that you could actually work with, that it was not immutable. You see, back then they taught us in medical school, and that the prevailing notion in all of healthcare was aging was inevitable. Nothing could be done to change it. Don't even try. There was a thing called the Hayflick Constant. And the Hayflick Constant used to, was this wall that you could not penetrate. And it said that basically mammalian cells, human cells, could only reproduce 50 times and then they would stop because they had a built-in,
shut off button.
Well, yeah, they had a limit to their ability to reproduce. Now, I didn't quite accept that notion.
Were you always that way? You always challenged what you...
Well, I think that almost always there's a better way. Not always, but almost always there's a better way. And if you don't look for that better way, you'll never find it. And in medicine, and in basic science even worse, they said, sorry, Hayflick Constant, you can't get any further, that's it, don't try to look for it. Anything else is fountain of youth, baloney, and it's unscientific, and it's quackery. And it turns out that the Hayflick Constant is true if you're a guinea pig, because it was done on guinea pig cells, and it wasn't done on human cells. That's number one. Number two is the Hayflick Constant is true if you do not replenish the cells with new serum, with new growth factors, with new nutrition. If you take something out of cells out of a guinea pig and put them on a petri dish, and you hold that petri dish up to be the same as a living organism, the guinea pig, well, things aren't going to be exactly right. And it was bad science. Okay, but it stood and it stayed as a bar against people studying aging for dozens of years. And I think the greatest success that we've had with the Academy of Anti-Aging Medicine is breaking these paradigms that said that aging is inevitable, that it is immutable, that there's nothing that can be done, because clearly an awful lot can be done, and the A4M has made it okay and safe for doctors and scientists to explore aging as a treatable condition. Because if you accept that it's immutable, well, you're not going to go there. Why even bother? The earth is flat. You're going to fall off the ends. So don't sail your ship out too far. And that's the kind of mentality that was ruling aging research at the time we got started.
So go back to the first conference that you put together. What did you do to market to the physicians out there, and how was it received at the time?
Well, there weren't very many doctors who were practicing anything akin to anti-aging medicine. The closest thing to what we had was preventive medicine, nutritional medicine. And I was already in the field, so I kind of knew all the players. So the first conference we had 30 attendees because I knew all 30 of them and personally invited them to our first event. I guess the reason that we created the Academy of Anti-Aging Medicine was because in 1991, Daniel Rudman at the VA hospital in Wisconsin published a seminal study on the use of growth hormone in these elderly veterans who were disabled, who couldn't get out of bed, who couldn't walk, who were just in terrible shape. And he found that after just a few months of human growth hormone, these people were making incredible recoveries. They were growing stronger, more youthful, they were growing more bone mass, more muscle mass, and this kind of was that moment in science where you say, eureka, we have a tool, something can be done, this is proof of it, and that was the topic, the major topic of the first. But his work was incredibly important because it made it clear that there were interventions that could be used to change the normal direction or velocity of aging and perhaps bring people back a few years.
So I also understand that you're quite a prolific inventor.
Well, Dr. Goldman and myself we started out as research partners in Chicago at the medical school. And from that point on, we really didn't quit with our research. We were involved in many different aspects of research all around, most of it around human performance. But I had, because of my background in human resuscitation, with intensive care and patients who were being, on life support, I had a strong interest in that area. And I had the concept at the time for a portable device that could be used in emergency situations for resuscitation outside the hospital. And it was good science. And it was good technology, and we raised a fair amount of money for it. And we proved basically that this technology could work in animals, but the barrier for human studies is so high. With the FDA, it would have been hundreds of millions of dollars. We had to switch the direction of the company away from cerebral resuscitation. This was to keep the head and the brain alive when the heart stopped in cardiac arrest. In a cardiac arrest situation, brain damage occurs in about 5 minutes. After 5 minutes, you start having irreversible brain damage. And really, it's very hard to reanimate an individual after 5 minutes under most circumstances, unless they're chilled, deeply chilled. But under most circumstances, people just expire. And we came up with a technology that would reestablish blood flow to the brain and would also cool the brain at the same time. And it was a very exciting technology, a great promise. And the problem is that because of the system that we operate under, FDA approval would have been hundreds of millions of dollars away as far as proving this technology in humans. And so the people who were underwriting the research, which were venture capital people at that time, who wanted a return and didn't want to wait those years and put those hundreds of millions of dollars into the research, forced us to shift direction of the company. And we were successful. We came up with a new device for organ transport, which would allow for the safe transportation and resuscitation of organs outside the body. And it helped to create the current standard right now for kidney transplant. Before we got started, you had to have donor to recipient transplant. So basically, you had to have a beating heart donor who you could take that kidney from and put it right into the recipient. With our technology, because of of our ability to take that organ, put it into a box in a computer-controlled environment with special fluids that reanimated and resuscitated the organ, we were able to keep those organs alive and actually healthier than when they were in the donor for up to 24 hours. And that allowed for many, many, many more organs to come available. So, this technology is responsible for thousands, maybe tens of thousands of organs being transplanted than before. But my disappointment is that we never were able to get the support and the funding to do the original plan, which was cerebral resuscitation. One day.
So did you have a patent, though, on this technology? Or
Oh, it was all patented.
It's all, okay.
Yeah.
Because I understand you have over 100 patents.
Over
with your
100,
name. Okay.
well, in the company,
Okay.
yes.
So what does it feel like when you walk into the World Congress at Vegas, or you come to a conference here in Hollywood, and you see the thousands of physicians that have now joined your A4M, and to further their education on what you started out, 25 or 30 plus years ago? What does it feel like when you walk into that room and you give your introductory speech in the morning?
Well, it's the best time of the year for me. It really is, because when you walk into a room and you see 2,000, 3,000, 5,000 physicians, scientists, health professionals, all sitting there, and no one's forcing them to be there. They're there because they want to be there, and they're actually paying for the privilege of being there. And they're taking times away from their busy schedules and from their busy practice. That just makes you feel great. It makes you feel like you were right, and that you're doing the right thing, and that the field is moving in the right direction. And that is the best feeling I have all year long.
Where do you see this field of anti-aging medicine, or regenerative medicine, or functional medicine, or integrative medicine? The terms seem almost interchangeable, although they're not.
Well,
where do you see it going in the next 5 or 10 years? There's so many new modalities out there, and the science is just explosive.
Yes, it is. And this is a new paradigm of healthcare that we've created, anti-aging medicine. And whether you call it healthy aging, happy aging, successful aging, regenerative medicine, integrative medicine, I mean, there's got to be 36 different terms that are being bandied around, basically by different groups that want to claim that they were first and that they were the legitimate torchbearers of the industry. And believe me, I'm happy to have them. I am so happy that there are so many of these organizations out there. But the reality is A4M was first. We had the vision, and these other organizations are copying our vision, and God bless them, because they're going to save my life and yours as well. And that's what it's all about. And whether you call it happy aging, healthy aging, integrative medicine, whether you call it personalized health care, it's really all the same stuff. It basically comes down to a longer, healthier, happier, more productive lifespan for everyone by attacking the basic problem. The problem isn't cancer, heart disease, diabetes. The problem is aging. You see, young people don't get these degenerative diseases that kill us. You see, young people die from trauma. They die sometimes from infection. They die sometimes, rarely, from genetic disorders, but they don't die from degenerative disease. Why? Because the cells are healthy, and because the DNA is young and youthful, and there is a tremendous reserve capacity and reparative capacity within the cells. But something bad happens after the age of about 25, 35. Things start to go south metabolically within us. Our bodies are no longer able to rejuvenate and repair and rebuild and regenerate. And so anti-aging medicine, or regenerative medicine, or rejuvenative medicine, whatever you want to call it, and I'm okay with it all, is focused on trying to reestablish those basic biological mechanisms that we had in youth, and to allow those mechanisms to extend the healthy, productive, youthful lifespan. And that's what anti-aging medicine is all about. It has been from the beginning. And now, 25 years later, we're seeing the basic scientists catching up and being able to tweak DNA, and being able to play with genetic and CRISPR and genetic modification, and being able to find new forms of antioxidant drugs, and being able to find cell markers for early signs of cancer, diabetes, Alzheimer's disease, so we can treat disease at the very earliest moment when it's curable. And that's what anti-aging medicine is all about. It's about a cure. It's not about palliation. And so it is in some ways, the cure to the problem with Western medicine. Western medicine took a wrong turn. It took a turn away from the cures and towards palliative care. Anti-aging medicine is trying to bring us back. And that's what I see as the future of anti-aging medicine. That's what I see as the future, the promise of what we're doing. And even more exciting is the new technologies we have of regenerative medicine. The latest numbers are that regenerative medicine is growing at a rate of 26%. 26% annual growth rate. That's insane. And so what we have is we now have, where before when I started, I had a hard time finding 30 doctors who were even interested in the concept of anti-aging medicine. Now the Academy, the A4M, the Academy of Anti-Aging Medicine, has trained in excess of 150,000 health professionals around the world, and we're training tens of thousands more every year. And these doctors are now controlling the healthcare programs of hundreds of millions of patients on the planet Earth. And best of all, is within the last few years, groups like Google and Amazon and these mega corporations are investing heavily with billions of dollars into anti-aging research. And as a cherry on top, the insurance companies are now moving into prospective preventive medicine, aka anti-aging medicine.
For reimbursement? Of
No,
these therapies?
not just
Oh,
for
okay.
reimbursement, for management.
Wow.
They're mandating that patients are treated in a preventive measure, with preventive measures and with advanced diagnostic tests that can foretell the future of one's healthcare destiny, and to intervene now, today, when it's curable, rather than waiting till it's only able to provide palliative comfort care. From my point of view as a founder, one of the founders of this movement, I'm extremely excited that there is so much new technology coming into the fore. And I believe that these technologies will lead to the grand goal of practical immortality, life expectancies of 100, 120, perhaps even 150 for almost everyone who wants access to it. And that's what's very exciting about it. But I agree with you, some of these technologies are in fact so new and the results are unknown, and we're going to have some bumps in the road, and there may be some untoward effects, but that's the way it is with everything.
So we talk about the extraordinary growth in the billions of dollars in this industry, but there's also all these organizations or companies or manufacturers that you have to be leery of. So how does one, whether they're a patient or a physician, how does one differentiate what is real and what the direction that they should go down, and what is teetering on, let's just say, it's not as efficacious as it could be?
Well, with every technology and with every new development and with every product, whether it be a new automobile or a new drug or a new form of gene editing, there is going to be a learning curve, and there's going to be a period where the results will not be as good as they should be, and as we get more experience with them, the results will improve and improve and improve. Now, from a point of view of the consumer, they're really, unless you are an expert in this field, unless you have studied the developments in the field of anti-aging medicine, it's very hard because the field is growing so rapidly and explosively. It's hard to know all these different things. You really have to depend on your physician as a consultant, as your healthcare consultant, and hopefully your physician's a member of the American Academy of Anti-Aging Medicine. Hopefully he's gone through a fellowship training program or some of the certification programs we have. Perhaps he's even board certified in the new specialty of anti-aging medicine. And he's in the position to tell you and to help steer you into what works very well, what is a little iffy, what maybe you shouldn't try yet, and what you should keep the heck away from. And it would be great if everything was perfect out of the box. It's not. And so you need the advice of a professional in the field. And that's one of the reasons and one of the roles of the Academy of Anti-Aging Medicine.
So let's go back and talk about the future. Where do you see your role in all of this, the next 5-10 years? What's next for you? What brings you inspiration every day?
Not dying. 3 rules of anti-aging medicine. Very simple. Don't get sick, don't get old, and don't die.
And what's your secret?
My secret is the American Academy of Anti-Aging Medicine.
Well, besides the obvious,
Okay.
what do you do? What do you do every day? What supplements do you take? What do you do in your own life?
Oh, we're going to need a lot more than 45 minutes. I'm taking about 60 different pills a day.
Wow.
Okay, and I'm taking a full smorgasbord of antioxidants, hormone replacement therapy, growth factors, immune stimulants, I mean across the board. Now, is it working according to my lab results? Somewhat. Is it working as well as I wanted to? No, but there's always tomorrow. And the magical thing about living today is that every day is another miracle. Every day is a cure for this disease, this disorder. There's new drugs, and there's hundreds and hundreds of new drugs in the pipeline right now that never were there before, all focused on aging-related disease and disorders. And all we need is 1 or 2 of these things to work really well to gain a huge increase in life expectancy. You know, my grandparents were old in their 40s, okay? My parents were old in their 50s. Well, I'm 63 this year, and I don't feel old at all. And there are many people I know, many of the doctors of the Academy, who are in their 70s and 80s, and they are running circles around me. And I have to believe that it's this technology that is making that possible. But it's only getting better because we have so many new promising developments that are underway, all due to our new understanding that aging is not inevitable, that aging is a treatable condition, and that's, I think, the legacy of my work in the Academy of Anti-Aging Medicine.
You know what, I think we'll just leave it at that. That seems like a very poignant place to do that. So thank you so much for your time, Dr. Klatz. I look forward to see you getting younger year after year for many years to come.
Well, thank you so much.